we'll go ahead and get started. So again, thank you so much for joining us today. We are excited to be with each and every one of you, and we're excited to be talking about the Health Office, which for some of you, in fact, perhaps even many of you, is sort of a forgotten gem. And it's easy to be that way because it's one of those offices or teams on campus that doesn't have a natural reporting infrastructure. And one of the things that we struggle the most with, or we find that our schools struggle the most with, is that it's actually something that even those who oversee and are tasked with managing the health office oftentimes don't understand all of the unique intricacies that go along with both basic treatment as well as some of the compliance requirements that go along with the health office. And so this is our second webinar of the series, and this series again is taking place every Thursday at 10 a.m. Pacific, 1 p.m. Eastern, and we're excited to share a variety of different topics with you. Last week we spoke specifically to our California schools about the changes in the immunization laws that have taken place over the course of the last 2 to 3 months and will really take place and take effect over the course of the next year or so. This week, obviously, we're talking about the health office and some of the unique needs, challenges, and other items that go along with it. And next week, we'll be talking about epinephrine, that wonderful EpiPen that has caused so many of you so much trouble and grief and anxiety due to changes in laws that haven't been particularly well communicated, for lack of a better way to put it. And following that, we'll continue to unfold various topics, each of them pertaining to school safety, and some of them specifically to the nurse and or whoever it is that's in that health office, others that will be specifically geared towards disaster preparedness and whoever on campus is managing disaster preparedness. And so without any further ado, let's go ahead and jump right in. We'll get started. After today's webinar, our goal is to ensure really two things. First, that you are able to create appropriate expectations for your health office and the team that works within it. So for many of you, you actually have a health office of one. For some of you, I suspect you may have a health office of none. And for others of you, those that you might consider yourselves to be uniquely fortunate, you may have a health office team of 2 or more. If you're a boarding school, you may find yourself with a health office of 3 to 5 individuals. And if you're a school that has a lot of unique needs, perhaps you have anywhere from 2 to 4. I will share before I jump into the rest of the presentation that I have many schools, all of them with a different makeup, and all of them with different health office setups. I have one school that has, and brace yourselves for this, about 60% of their population that is considered anaphylactic or responds to bites and stings or a food with a reaction called an anaphylactic reaction, or a severe allergic reaction that actually causes the student or the adult in some cases to have difficulty breathing, significantly drops their blood pressure, and it can actually be life-threatening. And so with a group of about 60% of their students that are anaphylactic and that have an EpiPen, this school has about 3 nurses that are on staff at any given time. And obviously, we do quite a bit of preparedness and training for each of those students, but really for the staff overall. Our second objective is that you understand the unique challenges that are often found within the environment of the health office. And one of the things that I'll talk about quite a bit today is that we find ourselves placing the health office under the care of either an assistant principal or an assistant head of school or perhaps even the business office. And again, the people who are tasked with oversight oftentimes just don't understand all of the unique intricacies. And so, again, my name is Chris, and I'm the CEO of Joffe Emergency Services, and we'll be walking you through these concepts today. And if you have any questions at all, on the right-hand side of your screen, you'll see a little pane that allows you to ask those questions. If you were with us last week, you'll remember that by the end of the webinar, we actually were running out of time. We stuck on for an extra 20 minutes or so to answer questions. But please do continue to ask those questions in there. They are always excellent eye-openers for us and help us make sure that we're covering the right material and the things that you have the biggest challenge, concern, and stress around. So let's get started. The way we'll talk today is we'll talk first about the 5th challenge, and we'll work our way up to the top challenge or top skill that's required for your school. So what I find is that disaster preparedness, which is actually a lot of the work that we do, certainly not all, but a lot of the work that we do with our schools is somehow related to disaster or emergency preparedness. And I've found that many of our schools seem to lump disaster preparedness and emergency preparedness right into the health office. And for some schools, that makes a lot of sense. For some schools, in fact, it's the only way to go. And for others, it doesn't even make sense at all. And so what I want to do is I want to take just a couple of moments to review the needs of the disaster preparedness program and then give you an opportunity to identify whether it makes sense on your campus. And as I do that, if you could go ahead and share with us, we've got a huge number of you on the webinar, and we're excited to have all of you with us, but go ahead and share with us in the chat pane who on campus is responsible for disaster preparedness. I'll let you go ahead and share those answers here, and I'll get started with talking a little bit about what that means. So disaster preparedness is one of these things that changes based on your location, changes based on your population, and changes based on the time of year for many of you. If you're in the state of California, well, it's 60 degrees all year long, so you don't even know what I'm talking about. If you're on the East Coast, you know that certainly during the winter, disaster preparedness might just be, you know, a Wednesday where it snows really, really badly. So oftentimes we consider disaster preparedness natural disasters, things like earthquakes, tornadoes, hurricanes, and certainly disaster preparedness does include those things. Some of our folks tend to think of disaster preparedness and think of human-made disasters, and so things like active shooter or lockdown. And certainly disaster preparedness does include those things. What I like to do is I really like to think of disasters as anything that applies to more than 2 people on my campus that's not good. In fact, that's not good to the point that it requires our community to respond. And so more than just actually dealing with the earthquake or the tornado or the hurricane, and you know, frankly, all of those things in terms of our general campus response are relatively easy. Perhaps not the easiest thing to do, and perhaps not something we want to do on a regular basis, but we're really comfortable as a general community with how to manage those types of incidents. Where we tend to struggle, though, is the actual management of the kids in the process. We tend to struggle with the reunification that goes along in the process. We tend to struggle sometimes with the communication that goes along with the process. And each of those things also falls into the disaster preparedness category. And so for those of you that, when I say disaster preparedness, immediately think earthquake, tornado, I challenge you to broaden your thought process around disaster preparedness and to ensure that it includes not just things like earthquakes and tornadoes and not just things like hurricanes and fires, but that it also includes the communication element that goes along with a disaster, that it includes something as simple as an anaphylactic reaction, which perhaps only applies to one person on campus, right? Only one student is developing or showing signs and symptoms of an anaphylactic reaction. But another person certainly ought to be involved, and that's certainly an emergency, and as I mentioned, can be life-threatening. And so I'll challenge you to broaden your thought process around disaster preparedness to really include anything that impacts 2 or more people on campus, and any time that you need to really activate a set of predefined protocols or procedures in order to be successful in managing whatever the situation is. And so with a little bit of context now around disaster preparedness, let's talk about who on campus should manage it. For some of you, I'm seeing that you've responded, well, my health office manages disaster preparedness, and that makes sense. It looks like many of you have an assistant head of school who manages the disaster preparedness efforts on campus. I'm seeing some of you that it looks like your business office manages the disaster preparedness, and as I suspected, at least one, I see teacher, but I'm not sure what type, at least one of you for whom your science department or a teacher on campus manages disaster preparedness. And that's really, it's a unique and challenging environment for that teacher probably, but also something that perhaps they've been pretty successful at. And so just to give a little bit more context behind who, all of those different people are capable of managing disaster preparedness, and again, managing the pre-planning, the execution of the protocols and procedures that we've defined and created in advance, and even the more challenging aspect of connecting kids back with parents, or a process we call reunification. So all of those people can do it, but who does it best? Well, the health office may be an option. If your health office is currently managing it and your health office is currently successful, then that's probably the best option. One of the things that we struggle with our schools is helping them understand how broad that disaster preparedness category is, and then really assigning it to the right person. And again, for some schools, the health office makes the most sense. And I would guess that that's probably somebody, and if not, I would recommend that perhaps we evaluate, but that it's probably somebody that has had some experience in managing a disaster, either intentionally or unintentionally. Oftentimes people with military backgrounds who have managed really large-scale emergencies or been in really large-scale emergency settings, even if they weren't responsible for the management of that emergency. Oftentimes just the exposure can set them up to be perhaps even more successful than anybody else on campus. And if that's what your health office looks like, somebody who has a military background, somebody who has been involved in large-scale emergencies in one capacity or another, then perhaps that person truly is the best person or the best team. That team is the best team to manage the disaster preparedness process. For some of you, it's your business office that manage, though. And oftentimes, the business office becomes the default because the business office is responsible for the risk management, responsible for the manifestation of disaster preparedness as it relates to the insurance policies, oftentimes is responsible for the business continuity plan. And for those of you that don't recognize the term business continuity plan, tune in and stay tuned into these webinars, because in September we'll be talking at great length about how schools do and don't have business continuity plans in place. And so for all of those reasons, for many of you, it may make the most sense for your business office to manage and oversee the disaster preparedness efforts. And your business office may even struggle with it a little bit because the knowledge and expertise may be strictly associated with the risk management side and with how the numbers all add up or don't, how the process ought to look or ought not to look. But oftentimes the business office has challenge when it comes to discussing with staff and faculty how they fit into the disaster preparedness program. Oftentimes the business office is a little bit more disconnected from the students, and so really understanding and representing and truly operating within the students' needs can be difficult for that office or that team. And again, for some of them it may even be incredibly successful, and more power to them. I have one school that's located in the Northern California area where the head of school is truly responsible for the disaster preparedness efforts that occur on campus. And I have another school in Southern California for whom the head of school is incredibly invested in the disaster preparedness effort and is incredibly associated, is very, very focused, and consistently reminds us and the entire community of how important safety and emergency and disaster preparedness truly is. And both of those environments seem to be very logical and seem to make a lot of sense. The difference is that at that school in Southern California, the head of school is involved in and certainly a big part of the disaster preparedness effort, whereas at that school that I mentioned in Northern California, the head of school is truly the responsible party when it comes to the disaster preparedness efforts. And again, either environment may work just fine for you, and so long as your head and your leadership team is supportive of emergency prep, it may or may not matter so much where it falls. But your head's office is one place that you might expect to find disaster preparedness. Next, and perhaps the most challenging and also very, very common approach to managing the preparedness efforts is to associate them with a science department, either a science department head or somebody who, for one reason or another, has just been associated and assigned the disaster preparedness efforts on campus. And I find that science teachers tend to take this on more than any other, but that certainly doesn't mean that other teachers don't. Again, in our experience, I would say probably about 20% of the schools that we've worked with, which is a pretty good chunk of them, have a teacher of one kind or another, and probably about 75% of those schools that have a teacher responsible have the science teacher responsible for preparedness efforts. And in your case, if it's your science teacher or any other teacher on campus and they're successful, again, I wouldn't rush to shift or to make a big change, but I would suggest that you evaluate whether that person has access to the leadership team and is getting support and buy-in, whether that person has access to the staff and faculty a couple of times a year, and whether that person truly has the ability to manage the disaster preparedness program, as it truly does consist of so many different layers. And then perhaps the funniest for me is that one person who used to be a nurse or used to be an EMT, oftentimes that person ends up managing the disaster preparedness efforts. And so if that person used to be a nurse and is now functioning as your health office or somebody in the health office, perhaps that makes a lot of sense. And if not, perhaps not. Nonetheless, the health office is certainly one of those groups or one of those audiences for whom disaster preparedness may fall right into their laps, and for whom, if it does, they're expected to do a good job, they're expected to be successful, and if we give them the right resources, oftentimes they truly are. I will challenge you to do this. Jot down what disaster preparedness means to you, and jot it down on a Post-it or a piece of paper. Jot down every component, every facet of the disaster preparedness program that you envision, and you can jot it down either by way of incident, right? So you can jot down fire, flood, earthquake, hurricane, or you can jot it down by way of response. So shelter in place, evacuate, egress, resume operations, or you could do both. But then really challenge yourself to ask the question, is the person responsible on campus for disaster preparedness truly capable of managing all of those things you just wrote down? And if the person responsible is not capable of managing those independently for one reason or another, seriously evaluate who on campus ought to either be a part of or perhaps take ownership of the disaster preparedness program on campus for you. Now, next, we'll talk a little bit more about disaster preparedness, a little bit more about the specific ways that the health office works. But before we do, I want to call out the fact that regardless of whether or not the health office is managing disaster preparedness, and regardless of whether or not the health office is responsible for all of those different facets that you've jotted down or that you're continuing to jot down, ask yourself this: who does the health office report to? What I've found is that health offices, and by the way, and I'll take just a moment to derail and share that I'm using the term health office very intentionally as opposed to the word school nurse. And the reason for that is that health office means so much more than school nurse. And in fact, today, health offices can be comprised of so much more than just a nurse. And if you're a nurse on the line, I should really watch my words. I should never say just a nurse. And if you're not a nurse on the line, don't ever tell your nurse that I said that. But I say that and I share that because the person in the health office can be so many different types of certification, or can have so many different types of licensure. Nurse certainly is one of them, right? Registered nurse. Another is EMT, and perhaps one of the less common but very capable groups of people, paramedic. These are people who have the medical training and knowledge to manage an emergency, and if delegated by the school the responsibility, are certainly capable of administering medications and helping to support airway activities, which that's that whole breathing thing that has to happen. Other people on campus that might be responsible are CNAs or other types of nurse that are perhaps not all the way up either yet, or perhaps never even will go up to the RN level. And so if all of these different people can represent or be a quote-unquote nurse, then why do they have a post-nurse level? Because all these different people have the same knowledge, or cases even more knowledge, about the specific needs of students in an emergency and the specific ways in which to go about medication administration and things of the like. So from now on, and basically throughout this presentation, we'll talk specifically about the health office, and I'll avoid saying nurse or school nurse or anything to that effect. So where does the health office report? Well, I found that this is actually one of the most challenging questions for any school to ask, and that's because generally in any environment, supervisors have a very clear and transparent and conclusive understanding of what their direct reports, or what the people who report to them are responsible for, right? If you're the business office and you have a controller in place, well, whoever it is that's supervising that controller understands very clearly what the expectations are of that controller, and understands without a doubt what the needs are, what the processes look like, and perhaps even help support that controller in a variety of different ways. Somebody who is a school director, perhaps a middle school director, a high school director, oftentimes, and I dare say almost always anyway, has a very clear understanding of what their teachers are going through and what their teachers are expected to do. They perhaps even were a teacher themselves at one point, and therefore have a good understanding of what the needs are. If you're head of school, oftentimes you have experienced what it's like to work in a school before. In fact, dare I say, almost always. You've been in a position in the school before of one type or another, and so you have this really solid and graspable, tangible understanding of what the expectations are of the people who report to you. Well, with the health office, we find that this is almost never true, because the person who's responsible for overseeing the health office, or the team that's responsible for overseeing the health office, is oftentimes the head of school, or an assistant head of school, or the business office. And those are probably the three most common places that we see the reporting infrastructure go. They're not the only ones, but more often than not, the health office is managed by one of those three teams, or one of those three groups. And what can be really challenging about that is that as one of those three groups, you're not expected to have any knowledge or experience in working in a health office. In many cases, you don't know much more than basic first aid and CPR, and that's okay, and that's expected, and it's not even necessary for your job for you to know or have access to more. But yet you're tasked with overseeing this team of people who is supposed to be saving lives on a daily basis, or at least administering medications. And so it can be difficult to understand what their needs are and why they're always telling you that they need time with staff and faculty, and why they're behind on their deadlines because they're going through as many immunization records as they possibly can in a 6-week period and they just can't get there. Or if you have a contracted service like you have a health aide from Joffe, you may find yourself just entirely detaching from it and going, you know what, get it done, make sure you get it done well, make sure that there aren't any phone calls that come in that are not good, and so long as that's happening, I'm good with it. And if you have a system like that and it's not a contracted health aide that you have in place, it's somebody who is an employee of yours and somebody who reports to you, I'll say the most dangerous thing to do is detach. And the most challenging thing to do is attach. But I'll challenge you to do so. Attach to that person, attach to their needs, attach to those things that they do on a daily basis, because you are responsible for their actions and their activities, and you're responsible for understanding at least how to keep them on track and how to keep deadlines met and how to keep compliance in place. If you have a contracted service like ours, perhaps you can detach a little bit more, because it's our job to make sure that those compliance metrics are being met and that we're doing all the things that we need to be doing at that time of year, up to and including communication out about flu season and managing the immunization records and setting up the drill calendar if that's one of the required tasks for the health office. But again, if you are, by way of staffing, responsible for the health office and you don't have somebody contracted whose job it is to worry about those things, then really it's your job to do. So where should the health office report? One of these three locations based on your school. Perhaps the location with the most experience or the most knowledge. If you've got a business office who has for years been involved and overseen a health office, then perhaps that person is capable and even wants to oversee the health office. If you have a head of school who perhaps has a medical background of sorts, one of my favorites is a school in Massachusetts where the head of school was a lifeguard all through high school, college, and then some. And so this person has a lot of understanding about the medical and emergency treatment that goes into the health office work. Then perhaps that is the best place for you. And if you're really not sure, the assistant head's office seems to be the right place to go. And it seems to be the most common place to go too. So if that's where your health office reports, you might be doing just the best you can, and or you might be on par with sort of the national standard. Regardless of who it is that's going to oversee the health team, the challenge that you have is to attach yourselves to them and to really understand the deadlines and the needs that they have, both from a patient management standpoint and from a compliance and deadline standpoint, because those are our metrics and compliance standards that really can't be monkeyed with and really, generally speaking, are state mandated or in some cases even federally mandated, and just absolutely must be adhered to. And so if you're one of those folks that goes, well, I think that we're probably on task because we haven't gotten a follow-up call yet, so we're probably good, go down to your health office and ask what the top 5 deadlines are that they have to respond to on an annual basis and see if they can articulate those for you. And if they can, there's a good chance that they're meeting them. If they can't, they perhaps are not aware of and or are not compliant with the deadlines that, and compliance metrics that you're expected to be compliant with at your school. So as if trying to figure out who manages disaster prep and then who manages the health office isn't enough, there's more. So what I'll do now is I'm going to share with you 3, and basically in order, 3 of the top challenges for almost every health office that we work with and almost every school that we work with when it comes to the health office. Thought 3, what about enforcement? If I'm a health office representative and it's my job to ensure that everybody on campus is receiving the care and receiving the medications and other needs that they may have, and I'm not doing that, well, how am I to be managed, or how am I to be, what follow-up should really take place in that case? Well, there are a couple of things to think about. The first is, are they life-threatening things? If so, then there's a serious problem. If I'm not managing things like EpiPens on campus or inhalers on campus or insulin on campus, and it's my duty to do so, then that's something that is a really critical and, in fact, even emergent thing to deal with. On the flip side, if I'm not managing things like the disaster preparedness program, or if I'm struggling with how to figure out the nutrition program or the health education program, perhaps those are things that either can be reallocated to somebody else or things that I can be supported on. One of the things that we do for many of our schools is simply consult with the health office, whether it's on a daily basis or a weekly basis, to make sure that we're able to help answer the questions and to support them on things like disaster preparedness or what deadlines come where. And so if you're struggling with any of those, my suggestion would be to pick up the phone, give us a call, and see if at the very least we can help explain what some of those challenges you might be finding are, and then some of the really quick and easy ways to manage those. By the way, I'm getting a couple of really great questions that are starting to pop up, so thank you so much. Please go ahead and continue to share those. One of the responses that we got from Shannon was me, the school admin, or the school admin assistant, and you know what, Shannon, you are not alone. One of the people who is most often responsible for the health office is actually not an EMT, is not an RN, is not a school nurse, but is whatever administrative assistant or front desk person or even assistant head of school person who can be utilized as a resource to manage small-scale emergencies. And oftentimes that person not only is utilized for that, but is also not necessarily equipped with training and experience and knowledge around these things. So Shannon, you may well be you may be excellent, and or you may feel like you're not sure what to do in these circumstances, or when head lice comes up, you're not exactly sure what they look like or how to find them. And so, you know, either way, know that you're not alone, and there are a number of people like you that have been assigned to a role like this. And I'll go off on a tangent for just a moment to say that this year, for the first time ever, we opened up our health aid training to the entire country. Basically, every year for several days before the start of the school year and before in-service week and before we go out and do all of the CPR and first aid training for all of our schools, we offer an intensive training that's geared towards our health aides, so the people that we staff to do health care for schools nationwide. And during that training, we talk about things like head lice, and we talk about things like special needs students and medication administration and immunizations and all of the things that are required for them to be really, really good at, in fact, dare I say expert level at, before they go out to any school. And so this year, for the very first time, we opened that training up not just to our health aides and to those that were going to be staffed at client schools of ours, but we opened them up to people like you, Shannon, and we said to everyone, you know what, if you don't have the training and background in this, but you've been assigned this role, come join us for a week. It might be a little bit overwhelming. It might be, for some of you, a little bit of review, but come join us for a week and learn all of the different things that go along with being a health aide or being tasked with health responsibilities. And it was incredibly successful. We did it the first week of August. It was a blast for us, for the health aides, and for the school personnel that had just been assigned a function or a duty like that. And so next year we'll do it again, and we'll probably do it at an even larger scale. So folks like Shannon, we would love to invite you to participate in that. And whether you come physically or we potentially may offer some type of online option as well, we invite you to participate and to gain that knowledge and to gain that opportunity, really to be confident when you're managing health needs, large and small. So again, go ahead and continue keeping those questions rolling in. We're getting some really, really good questions, in fact, some of which are even focused on last week's webinar, and we definitely will have some time to answer some of those questions. And it looks like, Kit, you had a question about last week's handouts, and those will be coming out probably tomorrow by email. So because you're on last week's webinar, you'll receive those by email. So I'll hop back in, and I'll hop back into thought number 2, and medical control. This is a really interesting and really difficult conversation to have, and the reason for that is that medical control is, well, if you watched Emergency growing up like I did, perhaps something that you understand. But otherwise, perhaps something that is so ambiguous and so difficult, and frankly, even within the healthcare setting, we struggle with understanding what it is and who needs it, when, why, and how we get it, and then we struggle with actually accessing it when we're actually in need right then and right now. But basically, the concept of medical control is this. A physician is going to, or oftentimes should, oversee the health program on campus. Now, does that mean that the physician needs to physically be there? Absolutely not. Does that mean that the physician needs to have online or by phone communications? Absolutely not. Does that mean that the physician needs to really do much? Absolutely not. But what it does mean is that when it comes to things like a generic epinephrine pen or generic EpiPen, as you may have heard of it, or it comes to things like your AED program, your automated external defibrillators, or it comes to things like evaluating who on campus is certified in CPR and first aid, or, and this is a pretty common one, it comes to things like individual students with individual or unique treatment plans, like any of those with epilepsy, or any of those that are diabetic, or any of those who have asthma, that this physician would help, in theory, to create the treatment plan or the program for these things. The other one that we don't think about all that often is that when we're administering medications, a physician should be supporting and, in fact, even prescribing the rights to administer those medications. And that's things as simple as Advil or ibuprofen or Tylenol or acetaminophen, and things as complex as seizure medications or insulin. And a physician should really be involved in the oversight program for that so that we reduce the liability on the school. We ensure that the student that we're treating is getting the absolute best care and the care that makes the most sense for them, and that we ensure we're compliant. And so if you don't have a prescription for your AED program, for example, you're actually out of compliance, and that's true in whatever state you're in. And that can be a frightening thought. If you have an oxygen program on campus and you don't have a physician's prescription for that oxygen program, you're actually out of compliance. If you have EpiPens on campus in most states that, and I'll clarify this, so this is one of those every word counts. In the states where a generic EpiPen is required, the majority of those states will actually require a physician's signature or prescription to be on file for the school in order to obtain and to have a generic EpiPen. What's challenging about that is that when you go online to order your epinephrine pen for your school and you say, hey, I want a generic one, you may go to any number of manufacturers' websites, and if you're wondering how to get a free EpiPen, certainly give us a call after the webinar. We can talk a little bit more about that. But if you go to one of these sites and you order an EpiPen, they'll ship it out to you, and they may not require that you get a physician's prescription, but that doesn't make you compliant. it actually makes them as a vendor not compliant. The same thing's true for your AED program. If you buy an AED from us, we're going to write you a prescription, and we're going to send a copy over to you, and we're going to send you your policies and procedures so that you have all those things on file. If you buy one from Amazon because it's $60 cheaper, or because you were able to find a used one on eBay, or you bought one from a school that was down the street that maybe downsized a little bit and no longer needed theirs, or maybe you just brought one in from home, or you got one at Costco, which, believe it or not, you can do. In spite of the fact that you may not have a prescription in place, you are, number one, not compliant, regardless of when, why, or how, regardless of the type of AED that you have. If it's in an institutional setting, meaning a school, you have to have a prescription on file. So if I need a prescription on file for all of these things, then would it make sense for me just to have what we call a medical director? And the answer for most schools is absolutely. And again, that medical director is normally a physician, and they normally don't do very much during the school year at all. But they are available to us, sometimes at a fee, and they're somebody who we can go to and say, hey, we're having this challenge, we have this unique situation with a student, we have this odd thing going on with our school in general. What do we do? What can we do? How can we be compliant? And that person generally will answer those questions for you, and again, perhaps with a fee, will resolve those issues for you. For those of you that don't have any sort of medical director or medical control in place, ask yourself these several questions. Number one, do I have an AED program? And if so, am I compliant? Meaning, do I have a prescription in place? Do I have policies and procedures in place? And do I have all of the other things that I need to have in place for that AED program to be compliant? And if you're not sure about those, then come back and see us. We'll probably be talking a little bit more about the AED program in October, November. Next, if I have students on campus who are taking any sort of prescribed medication, even if I have a prescription from their parents, which you should, from their parents or their own physician, am I compliant? And am I doing all of the things that I need to be doing? And oftentimes, if you don't have a medical director in place and you don't have policies and procedures for how you manage prescription medications, you will be out of compliance. And then ask yourself if you have any other unique programs that are unique only to your campus or unique to several schools in the area. Oxygen programs are one. Outdoor education programs are another. If I go on an outdoor education program, am I bringing any sort of medical A, treatment stuff, or am I bringing any B, medical treatment people? And in either environment, are those people authorized? Do they have the policies and procedures in place to do what they need to be able to do while we're wherever we are? And if you answered, no, we're not compliant to any of those questions, evaluate whether or not it makes sense for you to bring in somebody as a medical director. If you're the school nurse, you may have contacts and relationships with physicians far and wide. Oftentimes, if you have pre-existing relationships and you just give them a call and you say, hey, would you be willing to be our medical director? Would you be willing to answer a couple of questions for us a couple of times throughout the year? They'll say absolutely, and they'll say, I tell you what, we'll charge you $50 for a prescription, whatever you want. And when I say whatever you want, I'm talking about AEDs and oxygen. They'll say, we'll consult with you on unique needs that you may have or student challenges that you may have. And they'll say, and we'll do that for $100 an hour, or what the cost of a single office visit, or whatever the case may be. And so you can actually get a lot of really good resources from those people that you have pre-existing relationships from or with. If you're not sure or you don't have a pre-existing relationship with any physician, the next place to go is to your board. Oftentimes your board will have access to, if they're not themselves, physicians and others that may have relationships with them. And again, if we can use somebody that we have a relationship with, oftentimes those things are going to come at a lower cost, and there will be a lot less legality and challenge around bringing somebody like that in. And finally, if you're tapping all of those resources and you're not finding anybody that seems to make sense, and or you're tapping all of those resources and everybody seems to say, no, I don't want to participate, I don't want to support because it's too litigious and frightens me, which oftentimes is something that they'll say, especially when they're close to you and they feel comfortable saying something like that. Then give us a call, and we can help either by becoming your medical directors. We do have physicians on board, and or by helping to connect you with somebody in your area. One of the the things that we've done is we've established relationships with physicians in multiple states and who are licensed in multiple states so that we can help support the efforts regardless of where you are. But that doesn't necessarily mean that we have everything in place in every single state. And so if we don't have somebody in your state or in your county, if your county requires specific medical direction or a specific type of licensure for that person, we'll help connect you with somebody in your area who does have access to those things. And finally, the last point that or thought that I have in this conversation today is, who is this health aide? Who is this person who's responsible for all of the health and medical decisions that go on campus? And we've led into this a little bit earlier, you know, with regard to, yeah, it could be an RN, it could be an EMT, it could be a paramedic, it could be an employee, or it could be a contractor. And again, one of the things that we do for many of our schools is staff an actual health aide, and oftentimes those people are EMTs or RNs as well. In fact, they're always certified at least at the EMT level. We don't staff anybody lower than that. And we staff them and put them in place anywhere from 20 hours a week to 50 or 60 hours a week, depending on what's needed. In some environments, that person is responsible for the entire health and safety program for the school. And in some of those environments, that includes things like disaster preparedness and otherwise. In other environments, that person reports to somebody in the health office or otherwise and is only responsible for a fraction of the health and safety needs of the school. The most common use case for that, or the most common environment where we have that sort of reporting infrastructure in place, is actually boarding schools, where there's a team of anywhere from 3 to 5 or sometimes even more school nurses or school health representatives in place, and we're just 1 or 2 or 3 or 4 of those people, but that report in or work with a team of school employees. Either way, I share that with you for 2 reasons, obviously. 1, I want you to know that that program exists and of course is available to you. But 2, I want you to know that as we evaluate the best ways to manage and work with our own health aides, we find ourselves asking these same questions of ourselves on an almost daily basis. On campus, is this the right person? Is this the right setup? Is this the right framework? And so because we've asked ourselves those questions so many times, we truly can answer and help guide that conversation for you. And so if you're struggling with who it is that's managing your health office or what their specific responsibilities are, give us a call and we can help walk through some of the different ways that you may be able to become even more successful with your health office. I'm getting a couple of questions come in here, and I want to jump into a couple of them here. Beverly, you've got a great question. How do we go about obtaining a prescription for an AED? So you've got an AED in place, I would imagine. Now what do? The best thing and the fastest thing is give us a call. And based on where you are and the type of AED that you have, we more than likely can write a prescription for you, and it more than likely is a very inexpensive task for us to do for you. If that's not an option for you, or if you don't have the budget approval for something like that, and incidentally we're talking probably not even hundreds of dollars, probably tens of dollars, but if for one reason or another that's not an option, and you know, whether it's budget or otherwise, the next thing to do is really to go to that network. So go to the board, go to your network of physicians if you have one, and say to them, hey, I need a prescription for something called a Public Access Defibrillator Program. It's often abbreviated PAD, and because I didn't tell you that I was going to say that, I'll say it again. So Public Access Defibrillator Program. And again, it's often abbreviated PAD or PAD. And ask them to fill out that prescription for you. And basically, it's a relatively inexpensive endeavor because for them it's the same thing as writing a prescription for some cough medicine. And for most of them, they're very comfortable with that, and there's very little that falls back upon them in terms of liability or anything like that, especially if you have policies and procedures in place. So Beverly, if you have policies and procedures in place that limit the liability, probably very, very easy to get a prescription filled out. If your policies and procedures are in place and don't limit liability, it might be a touch more difficult. But either way, the best thing to do is give us a call, and we'll see if we can't help you with it. So great question, Beverly. Kit, it looks like you've got a great question. Do you have anyone that could come in and evaluate our current program to let us know if there are areas where we can, where we aren't in compliance, or do you have to have a physician do that? Excellent question. So Kit, we actually do school safety assessments, and we do those on a regular basis, and we do those for hundreds and hundreds of schools. And basically the way that we work is we'll send somebody out, we do a comprehensive analysis of what's going on from a disaster preparedness perspective, an emergency and general preparedness perspective, health and safety perspective, so looking at things from, truly, what do you do when there's an earthquake? Is that up to par? All the way down to, is your playground safe? All the way down to, do you have enough EpiPens on campus? And so certainly if you're looking just to have somebody come out and evaluate whether or not your AED program's in place or your current health office program's in place and successful, we can definitely do that. Or if you're looking for somebody to do a little bit more comprehensive analysis of the overall preparedness and health and safety program on campus, we could also do that. So at the end of this webinar, we'll actually shoot out a link that will allow you to sign up for a free assessment. And basically, you came and joined us on this webinar. You were able to learn, hopefully, a few tools and resources that you can use on your own campus. But in exchange, we also would like to be able to get to know you a little bit better and to be able to know and understand what are the unique challenges that you're essentially encountering on campus. And so we'd love to be able to provide that for you. And in fact, we should be able to get that link chatted out to you here in just a moment. So all of that said, again, we're excited to have you with us, and we're excited to be on series or event number 2, webinar number 2 of the series, and we're excited to be able to kick this off and continue this all throughout the year. And again, every Thursday at 10 a.m. Pacific, 1 p.m. Eastern, we'll be doing a webinar. Next week, we'll be talking about epinephrine and the generic epi versus non-generic epi versus on-campus versus student-prescribed, and how many do I need. So we hope to see some, if not all of you, again on that presentation. And we hope that your questions continue. You truly have some of the best questions in this audience. In fact, I'll just say it. Schools are my absolute favorite audience to work with because your questions are so good and because they're so thorough and thoughtful. And so please continue asking those questions. And again, we'll go ahead and chat out a link so that you can sign up for that free assessment. And we'll also chat out a link, 2 other links to you, actually. The first one will be a survey. And with every event that we do, albeit a webinar, an in-person event, we always ask ourselves, what can we do better and what should we do next time? And so if you could take just a moment to complete that survey, share with us things from, how is the audio quality, to how is the information that we discussed, how empowered did you feel walking away from the webinar versus any questions that you may have had at the beginning. So please take a moment to complete that survey. And next, we'll chat out a link so that you can sign up for the rest of the series. And so if you had questions today that either didn't get answered or haven't been answered yet, you're always welcome to sign up for the next event in the series. Or, of course, you can also email schools@joffeemergencyservices.com to ask those questions, to request an assessment, or just to get some more general information. And finally, we'll be sending out a link so that you can sign up for the free assessment and get one of our safety team members on campus. So without, it looks like the last couple of questions are going to be questions that are best answered on a one-on-one basis. So for those of you that have a question that hasn't been answered yet, stand by, and I would say expect a call from me or from somebody on our team in the next couple of hours or days. So that we can answer those for you. Some really good questions, but that are pretty unique to your campus. So good ones and more to come. And so all of that said, I want to just take a moment to thank you again for being on this webinar with us, for taking the time to explore and learn a little bit more about the health office. And we wish you all the best and a great and safe year for those of you that, of course, that are on here today. So thank you so much for joining us, and we hope to see you next Thursday.